everyone, good afternoon. Wow, we are finally online. I'm very excited about this session, and I'm very excited that Young from Gastein has finally the opportunity to host a full session at the EHFG. My name is Mari Pollari, and I'm the coordinator of Young from Gastein program. Young from Gastein, that's a network for young professionals working in the field of health, and especially in public health. We have absolutely very talented and incredibly knowledgeable professionals, and without their support, we wouldn't be online today. So thank you very much for everyone who has contributed to this session in the background as well. Tonight or today, we will have speakers from young professionals, and yeah, we are addressing one very important topic, namely mental health. We all know mental health has also got impacted by COVID-19, and today it's an opportunity to discuss what can we do to improve that, especially among young people. I'm very glad to give the floor to our moderator, Nick. Please, floor is yours.
Thank you very much, Marie. Hello, everyone. Welcome to this afternoon session, Working and Living in a New Normality, a spotlight on young people and professionals' mental health during COVID-19. So this is the last day of Gastein. I hope you've all been dancing with your elephants this week. We're looking forward to hopefully navigating this topic today. And to do that with me on our panel, we have Paul Hellison, who is a peer support worker with lived experience of depression and youth mental health. He is part of the he's the chair of the Youth Task Force for Mental Health Europe, a superb organization. We also have Emmy Nicole, who is a Euro Youth mental health expert by experience. Emmy is going to be sharing her experiences of mental health over her childhood, as well as talking about how COVID-19 has impacted her mental health and well-being during this time. We then are very lucky to be joined by Sarah Cerdas, who is a Portuguese member of the European Parliament, and as well as a member on the Committee of Environment, Public Health and Food Safety, and a champion for the Coalition for Mental Health and Wellbeing, also with Mental Health Europe. We also have Caulfield, who combines clinical work in emergency medicine in London with research at Karolinska Institute in Sweden, where she completed her MSc in global health. And of course, I'm your moderator today. I'm the director of Euro Youth Mental Health. I specialize in kind of mental health youth work, involved in various projects across Europe and beyond. So today, as you know, we're going to be touching on mental health, COVID-19, and associated impacts that have impacted their young people's well-being, their mental health, what it has meant for their livelihoods during this time and their professionality, and what's going to happen in the future. What is this new normal that we're talking about, and how can we make sure that young people are supported and given opportunities to continue working and have a secure future. This is obviously touching on sensitive subjects around mental health, so please just bear that in mind today, that some sensitive issues may arise, and that's okay. Be kind to yourself, look after yourselves, look after each other. And also, if possible, this is obviously going to work a bit better maybe on speaker mode if you have that luxury, if you're on your desktop today. So without further ado, I would like to hand over to Emmy, who is going to share her experiences of mental health as the keynote speech before we go into our panel discussion. Emmy.
Hi, everyone. So yeah, about my personal experience with mental health. So I think like the first notable thing I would have to say about it is that I first like noticed before having like a real perception of what mental health could be. I think it was around 5 or 6 when I started like to feel different, because some other kids around me made me feel this way. So, for example, I remember being working on the tip of my toes as a young person. And I remember, like, especially one day, like at a gym class, when I was 6 years old and I refused to do a stretching exercise because it was hurting me. One of the instructor got mad at me for that, and another young girl, like, who was probably very well intentioned, like she was probably 6 or 7, stepped out to tell the teacher to leave me alone because I was disabled and it wasn't okay. Isn't okay to force me to do that. But it made me, at this time, I remember it made me feel very angry, and because I have never thought I could be disabled or differently abled. I and didn't want it to be perceived as such because at 6 years old, I had a very stereotypied way to see disabled people. And yeah, so my first experience with mental health, I would say it was about like feeling very different from other people and wanting to fit in. So it started to make me wonder why she would think I was different. And after that, I started seeing a school psychologist because my teachers noticed I preferred to play alone, which made me feel very embarrassed because I had to leave the class for 1 hour every week, and everyone was aware that it was to see the psychologist. The next year, I started to see another psychologist outside of school, which was better for me because it was outside of school time. And I remember, and she was also a wonderful person that I remember as a very sweet lady who decided after more than a year that I was a balanced and healthy child, and it was all that mattered to her. So for me, mental health issues when I started to put too much effort into conforming to the norm, especially when I was 15, and that I realized that even though my high school friends that I loved had very different interests from mine, and I started to struggle to fit in and to have like very depressed thoughts. And what I appreciate through though during this dark period was that even though I felt very different from my friends and felt like they had zero interest for the things that I loved, they would always try to support me when I wasn't okay. So yeah, that would be what probably made things got better and helped me to handle being a young teenager. And things got better when I integrated a class with a focus on art and literature, which enabled me to find new friends with similar interests while still seeing my previous friends from time to time. So, and after that, after long years like of being sent articles about autism and what it really was, and having a lot of reflections going from, oh no, it could never be me, to maybe could recognize myself in some things, to, well, I should see like a specialist, a psychiatrist, and talk about it. It was, to me, I was finally diagnosed one day. And on this day, it was really relieving because to me, it was what really made an impact on having the tools to take care of my own mental health.
Thank you very, very much, Emmy, for that introduction into mental health. It's worth noting that obviously things have changed massively now with COVID for everyone's well-being and mental health. And just before we launch into the panel discussion, I just want to remind people that you can ask questions. If you put them in the chat of the Zoom box, we will be having time for questions at the end of our panel discussion. Our panel discussion is going to be approximately 30 minutes long. And yeah, we will do our best to get those questions to any of our panel members. So please do join in with that in mind. And just to reflect a bit on, so Emmy, do you mind me asking you to start as well? So you've talked about your experiences of mental health Can you tell me how have you been managing that during COVID and over the last 6 months or so?
Yeah. So to me, this COVID experience started relatively early because I was in Italy at the time when the lockdown started. So it started pretty early for us. So, but at first, like I was really, really privileged compared to a lot of people because I was living with my roommates and I was a very, very good friend to two of them, and I had a good relationship with the third one. So it was something very positive at first for me because, like, first of all, I was in complete denial of what was happening, and I just saw that, oh, for 10 days, I think, I'm going to have school online. And I took it as, yeah, I'm going to be able to do so many things, like focus on creativity, things like this, and just like a sort of vacation in a way, because to me, it the first like the beginning of the lockdown really made me realize how things that I wouldn't even notice as bothering could really make me tired. Like, for example, being around noise, like at university, being around people, being like having to do small talk all day, how much of disturbance it could be for me. So getting rid of this really gave me a lot of energy at first. And so yeah, I was in a very safe place at first, and I had a very positive and privileged experience of the lockdown. And managing my mental health for me at that time meant just spending a lot of time like exploring things that I like, for example, playing instruments, painting, um, taking really most of my time to just do creative stuff. And so yeah, after that, the problem that happened is that one of our roommates really couldn't handle the situation anymore, to the point like that we had to take care of her by ourselves, like technically like a child. She wouldn't like cook for herself, feed herself, and we had to really take care of her. And one day we felt like she was doing better and she decided to cook for everyone. But I think she was like in her mental state, she was so bad that she completely forgot what she was doing after finishing to cook. So she made like some dumplings that she had to fry, and she basically left the oil on the fire, which ended up burning our kitchen. So after like it was a she didn't burn entirely the kitchen, but it was still like a big shock to see that yeah, like basically it was like to see like the kitchen in flames. So we were lucky, like the situation turned out to be fine. The firefighter came on time, no one was hurt. But yeah, it was still a big shock because we had to leave the house because we couldn't use the kitchen anymore. So from one day to another, and also this happened like 2 days before the end of the lockdown in Italy. So yeah, it was a very brutal like post-lockdown shock. So yeah, the situation was very weird. Like the coronavirus was still around. We had to readapt to being outside, but still being careful. And also for me, I had to change my house, so my entire environment was disturbed. I had exams coming up, and I also had to face all the responsibilities and the engagement I took when I was full of energy at the beginning of the COVID. I started a lot of things, and now I had the responsibility to finish them, which is something that I wasn't able to manage. But yeah, that was pretty much to this day. Like things got better. I was able to find a balance in this new situation. But yeah, for me, I would say that the post lockdown was really the moment where I had to face like what the new reality was like.
Thank you, Emmy, for that insight. And I think it's interesting, like you say, because initially there was this almost, it was meant in a positive light, pressure to use this time to better yourself. Let's all go and do these fantastic projects that we have been putting off because of work and because of the commute. But as you say, it's this pandemic is bigger than that, and it's hit people a lot harder. Thank you for sharing that. I'm going to move on to ask for some people's reflections now, and I guess just some statistics as well. The Belgian Public Health Institute, Sciencenor, has collected 44,000 respondents asking about the implication of COVID-19 and mental health. And the survey found that people between the ages of 16 and 24 would be among the most affected. The prevalence of depression has tripled in young women to 30% and quadrupled in young men, which is always just went up to 29%. Sarah, if I may come to you, what's been your experiences of COVID and maybe any reflections you might have around young people and young professionals' experiences?
Yeah, thank you for that question. That is quite relevant because I'm actually, you introduced me as an MEP, but I also have another hat, which is I'm a medical doctor and I'm specializing in public health. And I just want to say, first of all, thank you for the invitation to speak here for such important topic. It was always, well, one of my goals to be in Gastein, previously as participant. So thankfully, you guys invited me to be here and speak to you about this. So at the EU level, mental health has had some expression and some attention has to be given to this. As I said, I'm a medical doctor, so I have the experience of junior doctors in Portugal, and there's a study that says that almost a third of them are on the edge of burnout. So, and this relates to working conditions also, but not only. So this pandemic came to open this whole Pandora box, and we need to address mental health more enthusiastically when we speak about health. It's not only physical health, not only the social aspect of health, but also the mental health and well-being aspect of it, hence the importance of hosting and having this event today and speaking to young people. Young people have been, if they are millennials as myself, we are now in the second crisis of our adulthood. We've been to a first crisis where we had some troubles getting some jobs, and now we are in the second crisis where we have more troubles into our adulthood, and this has important consequences for the employed population and for young people particularly, because yesterday I was seeing that my med school started with the new incomers, with the first years, and they all separated by 2 meters distance. And it made me wonder, for all new students at universities, how are going for them to be having a social life? And the social aspect is quite important, because without social support, it will be much more harder to entail all the academic endeavors, and this can reflect into having more mental health issues and more mental ill health. And this is quite an important, this is just an example of how mental health needs to have a proper space. In the pandemic, and it was said here before, it is quite important for one to take care of itself, but it's also important to understand what are the people that are being more struggling more with the pandemic, not only with the work conditions and the different work conditions, but also with all the confinement measures. And this is something that wasn't talked enough, not even at the EU level, which is those people that had to stay home and that have some mental disorder, and how was the follow-up of these patients that need to have continuous care, and they somehow got a bit left behind by the pandemic. And this is something that needs to be talked about, because it's not only physical health that's important and being laid back, but it's also about our mental health and well-being. And it's one of those silent diseases that it doesn't mean, even though we don't see it, it doesn't mean it's not there. So that's why I'm a strong advocate for having more policies on mental health and well-being at the EU level now in this capacity as an MEP.
Brilliant, thank you, Sarah, and apologies for not recognising your fantastic other hat. Well, let's touch on that a bit. Alex, if I may come to yourself, Sarah mentioned about, professionals and people on the front line at the moment, and students going into uni now. What's been your experiences as working in healthcare at the moment during COVID-19?
Yeah, thank you for the question, Nick, and good afternoon, everyone from rainy London. I think Storm Alex is on its way here shortly. It's a pleasure to speak today and to speak about a topic that I think is so important. So to answer your question, my own experiences working on the front line in London, I think I can relate to what Emmy mentioned about things changing so quickly and so many things changing so quickly, one after another, overnight. So from a healthcare perspective, the work was very different. There were more patients, they were sicker patients. We were working in PPE. We may have enough PPE one day, not enough the next day. And it's physically very tiring to be working in the PPE for long shifts. In addition, your communication with patients is harder. And actually, for a lot of people who work in the healthcare sector, that's quite a rewarding element of the job. And that was disrupted. It was more difficult. Equally, communication with colleagues, supporting each other is so important. And PPE makes that more difficult as well. And of course, things were changing overnight in terms of best practices. What we should be doing with patients. So it's cognitively very tiring, taking in so much new information so quickly. And also the risk that you, of course, yourself would be infected by the virus, not knowing who it was going to affect seriously, and the worry that you might take that home to your family at home. So a lot of healthcare workers were isolating, and of course that reduces your support network. So I think we can see just in that one example, a kind of example of the broader picture of COVID's effect on mental health, which is that it's not only increasing stresses, but it's also reducing our normal sources of support. So it's kind of attacking both ends.
Absolutely, thank you for that, Alex. I think, and you've touched on a very important topic, obviously, around support network. Sarah mentioned new students going to university for the first time and then being told to stay in their room and have no social network now. And obviously there's the fun side of that, but there's the emotional bearing that carries when you left home for the first time ever. And likewise then, when you are a professional, been in it for a good few years, you rely very heavily on your close network for support, your friends and your family. Paul, if I may come over to yourself. So Paul, you've got experience of doing peer support work, and I guess, and you mentioned obviously that you have been continuing to do work during COVID-19 and support people. Can you tell us a bit more maybe about the importance of peer work, and maybe how has it worked during COVID-19?
Yeah, well, something that's quite interesting that I noticed lately, I also teach at university, so I had the interesting opportunity to observe what is happening to new first-year students entering university. And this part about social support structures is really something that is bothering a lot of young people. There's two things happening at the same time. They are getting into a whole new situation, leaving the home, getting into a very different type of education where a lot of different skills are being asked of them. But they are also entering a new institute where they are not familiar with yet. So there's two things happening at once that are both quite hindered by the COVID situation. So for one, they don't really have the opportunity to get this connection with this new institute, the school that they're getting into, not getting to know the teachers, not getting to know the university itself, not getting to know their classmates. So for them to have this connection with what they're actually doing is really quite hard. And I think this is also a valid point for very new young professionals who are just getting into a new job with not having this connection with the company that they are working for. So that's one thing on the one side. And then also having to do all this whole workload from the home, where you have to make this support structure in structuring your activities for yourself instead of having this external structure, is really another burden that is making this whole situation quite stressful for a lot of young people. So what a lot of them are saying is that they are missing this support, having some people to share their experiences with, maybe also sharing ways to deal with this situation, and maybe some experiences of other people who are also in the same situation. How are they dealing with that? So this is also where peer work comes in quite a bit. We are noticing in one of the online e-mental health forums that we are using, where we also provide peer support, that there is a lot of sharing experiences in things that young people are dealing with right now that are particularly pertaining to these kind of things. How do I find my place in the workplace? How do I find my place in a university? And how do I deal with all these things that I have to organize for myself now that I'm used, are usually supported by some kind of external structures that are provided by the organization or by the institutes that I'm working in or studying in. So really sharing these experiences and feeling that people are not alone in this situation, that they are not the only person dealing with this situation right now, is really something that's lacking for a lot of people, because of course they also don't have the context with other young people that much anymore. So they can feel quite isolated in this situation, which is yet another stressor right now.
Absolutely, Paul. And I guess so you talked about peer work then as well. So can you tell us a bit more about what that is, and then elaborate what work directly you've been doing with young people in COVID-19?
Yeah, for sure. So one of the things that we are doing a lot, but is being a bit hampered by COVID as well, is that we're providing how do you say that, psycho education in schools, because for young people it's very hard to even talk about mental health in the first place. So this is a kind of very low bar support for young people to even recognize that they have a mental health. That doesn't always have to be a problem in the first place, that everyone has a mental health, that's just a part of life that you can take care of. And really providing them with like the literacy, mental health literacy, to be able to talk about what is going on in your life, which is something that is especially important right now, I think. And the other thing, what I was just talking about, is the e-health that we provide, which is a platform that is especially catered to young people with beginning mental health problems. So it's mainly a preventive system, and there's all kinds of things to do on that platform, but a very big part of it is the social networking site, where a lot of peer support workers are working with these young people on this platform and providing support from their own mental health experiences. So they're all people with lived experiences, who are not just providing support from a professional perspective, but also sharing their own life stories, what's going on in their lives and how they are dealing with it, and making people feel that they are not alone in this, and that there are ways to deal with it, and that there is hope for a better situation. And we noticed that that's really appreciated at the moment.
Brilliant, thank you for that, Paul. Sarah, if I may come back to you. So you talked earlier about how this has kind of mental health has become a bigger issue again because of the pandemic, and the EU and members of European Parliament. It's shone a light, if you will, on mental health. I guess I'm curious to ask, you know, what is being done, what discussions or any practical things that are happening now at EU and at European Parliament level. How is this being managed for the future? It's a very big question, I'm aware of that. So
yeah, and I have a short answer, I guess. You know that now at the EU level, we're preparing the next 7 years with the budget, EU budget, and also we have a recovery fund. We're talking about a lot of funds, but what we have is a mandate by the Commission to have a strong program for health for Europe. It's called the EU for Health. So I'm one of the legislators on this file. I'm actually the spokesperson for my political group, which is the second biggest at the European Parliament. And what we're doing is we're including the mental health capacity at this program. So this program will shape EU policy for the next 7 years, and we have the mental health dimension here, but there's more that needs to be done. We also need a strong action plan by the Commission, and this is something we had from 13 to 18, so 2013 to 2018, but we need something more continuous, because as it's been said, of this situation impacts our health and our well-being, and not only physically but mentally, and one can connect to the other and very well. So this is something that also needs to be done at the level, at the member state level as well. So some ministries of health in the EU have programs for mental health, others don't have. So ideally, we would want all 27 countries and member states to have program as such. And third, we need you. So all these persons that are here in the panel that are working at the local level, regional, national level, we need your support to also continue doing your work and make this a reality. So I also, as Amy so greatly put in her testimony, we need more awareness for mental health, but not mental health as a disability, but also to empower mental health and to also tackle mental health as with the same importance as physical health has, because I usually give this example. When you say you have pneumonia, people say, okay, stay at home, make the medication. If you need anything, I'm there. If you say, I don't feel well to get out, I have depression, people will say, oh, come on, just come, that's nothing. So this is the difference, and this is the part of awareness we need to do. And this is something very crucial, just to finalize my intervention, that we're tackling in the EU for Health program, which is education for health, capacitating people to be more aware about all these aspects of mental health, but also how this entails with all other aspects of life and well-being.
Thank you, Sarah. I've actually got a follow-up question, if that's okay. Is it so? I think I'm aware of the EU for Health program, and it looks fantastic. I guess what responsibility do you think? So thinking about young professionals and the how people have lost young people have lost their jobs, and now anxiety is driving up because they don't know what the future holds. What responsibility do you think employers and businesses have to be more understanding about mental health so that they can support their employees, to continue and so on?
Yeah, so this is important, and I would refer to the some of the proposals that the EU has made. One is the SURE mechanism to tackle the unemployment, and this is quite important. It was 100 billion that we approved in 3 months, and for those that are a bit familiar with EU institutions, 3 months is very, very fast, unfortunately, but it is. It's very bureaucratic here. So what I would say, this is quite a good package for member states to use, and then employers to use, and then also capacitate employers to be more aware about health and well-being at work. So we have the EMPLA committee with which is the committee here at the Parliament that deals with social issues and employment, and how to have healthier workplaces, and how the workplace affects mental health. And being unemployed is a big stressor for health. Actually, that that was a part of my PhD thesis, was psychosocial factors in work and how they affect mental health. And this is particularly for young people, because then there's this whole frustration that comes where you're supposed to go a certain path, and then that path is not is interrupted by society externalities, not because of your own capacities or because of your own choices. And this is something that is important to address. So I would say at EU level, we're trying, or at least I'm trying my best, and my political group is trying my best in member state level, but also we need a lot of action from the bottom up as well. So to put mental health in the agenda of in the political agenda, not only at EU level, but at member state level. And I need your help for that.
Thank you very much, Sarah. Emmy, with that in mind, so thinking about, you know, as a younger person here, we're thinking, so do you have what are your thoughts about the future for yourself about work and jobs? Do you have any anxieties? Is this, or what's your, how do you think COVID-19 might impact your ability to get work going forward?
For me, for this issue, I'm a very privileged person, because my job, like, since I went to the United States in the past, and because having a work visa in the United States when you're not American is so complicated. I never thought about like having a regular job like really in America. So what I did is that I took like this online job on this website where you give like lessons on Skype, or to like French lessons on Skype to English speakers. So for me, I am very privileged, because during the quarantine, I was able to work. And I know, for example, my mom, who works on a restaurant, my aunt, and many people in my family weren't able to work. And it made me realize how privileged I was in this moment to have this job. Even if it's like a student job, it doesn't pay like so much, but yeah, like at least it makes me feel like safe to have this money aside. So yeah, but I know like it might be terrifying, like to young people looking for a job, and even me for the future. I don't want to do this all my life. I'm still a student, but when I finish my studies, I want to work in art restoration. But yeah, obviously I have this question for me that, oh, will people be willing to put money into restoring like or even or churches or museums or artworks if a crisis hit? Yeah, so
That's a very daunting thought, isn't it? Thank you, Emmy, for that. Alex, I'd like to kind of move a similar question to yourself, I guess, would be about, you know, with yourself as a young professional and potentially peers. How has the landscape been amongst you and your peers for work in the future?
Thank you, Nick. Yeah, I think I was reflecting on this actually before the discussion, and I think healthcare workers have been in quite an unusual situation in the pandemic, because it's one of the few professions where sort of imminent job loss hasn't really been so much of an issue. I mean, obviously, bodies on the ground. We've needed as many people as possible, and certainly some older doctors have come back as well, and people who've left the profession. But then I think there's a real question around sustainability, because already before COVID hit, there was an epidemic of burnout that we know amongst physicians. You know, that's speaking from my own experience. Of course, we know about nurses and the struggles there, and then we don't really know much about the staff who are working in social care homes, for instance, who are a huge part of our healthcare system, but not very much research is done in that area. So it was difficult as a baseline, and now you've got the pandemic on top of that. So how do you encourage people to want to stay in that profession? You know, how do you protect their mental health, that they can take on those challenges? And young health workers will be key to that, because we know that they are at more risk of mental illness than their older colleagues, for instance. So I think it's going to be about keeping individuals in the healthcare profession. And there are certainly some challenges. One thing that's been mentioned a lot in the literature is the idea of moral injury. So the idea that you are accustomed to giving a certain level of care in the context that you're in. And then when you suddenly can't give that level of care, you sustain a moral injury, which, you know, you might live with for a while, okay, but that could really have later repercussions on your mental health and your ability to do your job. So I think we've got real questions around sustainability, keeping people in the healthcare workforce.
Thank you very much, Alex. Paul, thinking about, so actually reflecting on, you studied, sorry, you don't study, you teach at university. As you've started the university term, has there been any kind of discussions about, from students then that you've worked with, about this sort of concern as well, about the future and the anxiety of job loss, jobs available? I think Emmy made I loved Emmy's point about thinking about the creative and art sector potentially being those as opposed against practical jobs that might lose out. What's been your experience, and kind of what have you heard in those circles?
Yeah, definitely heard this concern quite a bit. It seems like, especially in the sector that I teach in, there's already some level of worry all the time. Whether can I get a job later on? Will there be a place for me? Will I be able to qualify compared to other young professionals? Would I be good enough? But it seems that since COVID, this worry has become much more salient to them. A lot more coming to their minds, and a lot more worried about their own futures. And this is especially true for the last year students, or the students who have just finished their education and are trying to get a job right now. So in the short term, can I get a job, and will I be able to maintain a job? That's definitely a worry. But another worry that I'm noticing is for people who are already in the workforce right now, is that they have this sense that because of, I guess this also kind of applies to the moral injury that Alex was talking about, is that they are worried that they are not developing in a way in their own profession that they should be developing at, because they can't perform their work in the way that they normally would. And especially because they are new, fresh professionals, they are still realizing that I need to develop myself still in this profession. I still have a lot to learn. And to maintain my profession into the future, I need to display some kind of development and professionalization that's perhaps I'm not getting right now. So it's both a short-term concern, but also a long-term concern, whether they will be able to, well, maintain their professional career in this way.
So let's think forward then, and positively. Paul, I'm going to stick with you for a second. So you're thinking about, you know, those conversations that I think is really highlighted. So the adolescents and teenagers that I've worked with, they've also been really worried that their GCSE, in the UK, the exam you do at 16 is a GCSE. Their worry is that they're not, the quality of education that they're getting is nothing compared to those before them, and won't be there for them, and won't be the same as those after who haven't had to go through this. Do you have any sort of, how do we navigate that? How do we support those young people? Maybe let's talk about, you know, student level at university. How do we support this group of young people to make sure that they are trained and feel confident in what they want to do in the future?
Well, I think what many students are at the very least noticing is that the education that they are getting right now, even though it's different, is still quite good, luckily. So that's a bit of the concern for them taken away, and also some reassurance from the teachers, for example, that what the level that they are performing at right now is quite similar to what students in the years before them performed at. And this is something, for example, that we see in test results, that, for example, for exams, students are actually still performing at the same level that students in the previous few years were performing at. So that's at least some of the concern taken away. But that's, of course, on a very much knowledge level. And there's also the skills level that you develop as a professional. And this is a little bit harder, I think. So for this, there's really the need, I think, for a lot of, how do you call this? Letting them realize that they are still doing okay, that they are still doing well by reinforcing that belief. And for this, I think there's still a little bit of a lacking support for that right now. This is a social support system that wasn't really needed before COVID, because you would meet people, students on the spot, and you would be able to reinforce them right there. But this I think needs to be more explicit right now, because it's not that noticeable in the implicit interactions that you would normally have with your teachers or your fellow students, for example. So that would be the main tip I would give to the educational system, and perhaps also to the work environment in general, to give this positive reinforcement much more explicitly than maybe you're used to.
Brilliant, thank you, Paul. And I guess it goes into what I was talking to Sarah about, the idea that actually employers and education institutions have to behave and be trained in a way that is supportive to young people going through this sort of situation at the moment, and may think they're missing out. Like you say, even if they're not, it's the extras that matters. So we're just moving on into Q&A in a minute, but just before we do that, I just wanted to ask you all, how have you been looking after your mental health during the COVID? It's not been easy, and how have you found it? Sarah, if I can start with you.
Yeah, it's not been easy. So mainly I just spend now my days here at the office in Brussels with my team. We eat here, so it's not as healthy as it should be, as we spend 8, 10, 12 hours a day in just this space. But also it's important to just find not hobbies. I wouldn't say we should all start baking bread as we did it during the confinement, but we should start thinking about taking time to ourselves. So this is something I implemented in my team, is that, and sometimes I have to kick them out of the office to stop working for the day, because they're a bit of workaholics as well. And it's to try and disconnect, and this is quite important, and look after yourself, even if it's through painting, through gym, through workout, through getting for a walk or going outside. This is quite important. This is something that it should be more implemented at the workplace. I confess we're not in that place at the moment in my office because of the whole COVID situation. We cannot eat, but it's something I try to put in my team, is to take time to ourselves and to disconnect. I usually tell them I'm the only one that cannot disconnect if some emergency arrives, but they should disconnect, especially on weekends and after the work journey.
Thank you, Sarah. Alex, what about yourself?
Yeah, I think just taking up that theme of finding the time to disconnect. So I would give the example of the British Airways lounge in my hospital, which moved in. It wasn't found in the airport, but it was temporarily in a London hospital. And that was a kind of relaxation space that was run by the British Airways staff who'd been furloughed or even lost their jobs as a result of the pandemic. So we could pop in there, be served a coffee, have a chat. There were some mindfulness activities. There were feedback forms for what we would appreciate as health workers. And it was fantastic. It was really fantastic because it was not only good for us, but it was good for them as well. And the staff from the airline really enjoyed doing it. So, you know, there are positives out of all of this.
Brilliant. Thank you very much. Alex, Paul?
Yeah, especially the first few weeks of COVID were quite hard on me, I would say. the lockdown situation, and especially noting, I think this kind of also mirrors what Emmy talked about, that it at first felt like a relief because there's a lot of things that you don't have to do anymore, but then that sudden realization that deadlines don't wait for COVID, for example, and that a lot of stress suddenly emerged from that. Yeah, so the main things I would say that are still a little bit hard are that there's a lot of things that you have to work a lot harder for right now. Getting out of the house, getting your social interactions with people in, providing a structure for yourself to structure your day, the work and social life balance from working at home. Those are things that are really things that I have to work a lot more deliberately on right now, and that also take energy that you normally wouldn't have to spend. So I would say I also have less energy to spend right now on daily things than I would normally have. So still trying to find my way.
Brilliant. Thank you, Paula. And Emmy, what have you been doing that's helped your mental health during COVID-19?
So for me, I say like, yeah, a big part of it came from having at least two very like supportive people next to me as roommates. And I would say like a big part of it was cooking for each other. I mean, yeah, like having a Southern Italian in the team, like we cooked a lot. She made us cook so much. And we would have like big meals, and yeah, like it wasn't like maybe the healthiest like dishes we would make like of all time. We would make like a lot of pastas with very heavy stuff. But it was just like spending this time cooking together, like focusing on how to make like things right instead of what was going on right now, spending time together. And yeah, for me, like anything that was creative, like trying a new recipe in the limits, because obviously we couldn't buy like everything. Like, for example, if we would find flour, we would already happy because everyone was making their bread at home. But yeah, like creativity or something that also helped me, I guess. But like it's biased because sometimes it was overwhelming to take like so many hours to make French lesson a day. But on the other hand, like it was keeping me focused on something else. And I would say, yeah, also like I've been trying to fundraise things for a nonprofit I was working with when I was in the United States. So all of this kept me very busy. So I was more like, I would say I chose like to be anxious about all the things I had to do instead of depressed by the current situation.
Thank you, everyone, for sharing those personal experiences and how you've been trying to keep going. So thank you, everyone. We've got some questions, if that is okay. Sarah, I'm going to come to you. The first one is for yourself, if that's okay. Benedict Faur says, thank you for interesting discussions. In 2019, the European Health Parliament proposed recommendations on mental health. And there is a link there to the Committee on Disease Prevention and Management 2018-19 that we run for health. Hopefully you're aware of that. Amongst the recommendation, the committee suggested to create an EU reward system for companies taking active steps to ensure a healthy environment for mental well-being at the workplace. What's your thoughts on this, and how could the Parliament support the implementation of such a scheme?
Hello, that's actually quite an important recommendation. This year I've been involved with the European Health Parliament. I also endorsed the mental health paper of them and their proposals. And it's quite important to have some sort of reward system. I usually give the example that, well, now I'm my own, depending on my own, but before I worked in Portugal and then in Sweden as a PhD candidate, and the work environment was quite different. In Sweden, there was this, and there is this effort to have the employer to have all this protection of health, of their health. And I can give you examples. We would have, for instance, and this is details that I've never had in Portugal. We would have ergonomic chairs, we would have free time for exercise, we would have massages at work, we would have yoga at work. This never happened in Portugal. In Portugal, I worked as a medical doctor, and if I needed, well, no, the chairs weren't even a question. So it's important to have something that is harmonized across the EU, but that's of the competence of EU member states. So this is important because the provision of healthcare is of the competence of each member state. So we cannot tackle that at the EU level, but we can go beyond it because the EU treaties actually say that we have shared competence on the protection of public health. So we can put mental health here and we can actually tackle this. I do believe it's a quite interesting proposal. I do think that this could be done, for instance, in the ESF, which is the European Social program, and this can be, I think it will give more resources to employers to have this for their employees. It will be important to have this reward system and to have that in all member states and not only this so many difference between one and the other.
Thank you very much, Sarah. It sounds like a very interesting scheme. I don't know if anyone else wants to comment on that across the panel. I'm going to say that.
Sorry, Nick. Oh. I had an interruption at the moment. Can you?
No, that's okay. I was just saying it's a very important and great sounding project, and I was asking the rest of the panel if they had any further thoughts on it. Actually, if not, I do have another question for Paul. Paul, you mentioned, so I've been getting questions on my phone. You mentioned the social isolation that new students find themselves in. Since social distancing will, I would say may be continuing for another few years, what do you think are the remedies or solutions for young people to get in touch with others more and establish a support system in new places?
Yeah.
Solve that whole problem in 2 minutes.
Oh, yeah, for sure. Well, thank you for the question, first of all. So I kind of have two kind of different levels of insight in this. One thing is of course, everyone is getting a little bit more socially isolated than they were before COVID, but there's also young people who are really struggling with it. So one of the insights that one of the young people that I was working with gave me is that she for herself realized that the hardships that she was going through right now, including loneliness and social isolation, are things that she recognized for herself already before COVID, but are just being emphasized much more now during this situation. And for her, she said it is really important to realize to which degree her current situation was being influenced by just the way she is normally, and in which way it's being influenced by COVID, because the way she explains things for herself, her situation, and the way that she deals with it is really from the experiences that she already has from normal life. So she was less focused on how can I deal with this specifically during the COVID situation, and what do I specifically need to do differently right now. So that's on a very individual level, making young people reflect on what is the influence on COVID on my social isolation, and what can I do about that specifically. So on a more general level, and that's what I see quite a lot happening already within universities, luckily, is that there's quite a bit of having young people almost forcibly interact with each other. For example, in classes where they are put into like small working groups where they have to work on assignments together that they would usually do individually, but also outside of the actual academic work, where it's very much encouraged to meet also on a social level. So something we see happening quite a lot is that young people organize meetings on Teams or Zoom, for example, with each other, also just in the morning before classes start, to have a coffee and just have a chat with each other, or in the evening after a long day of having to follow all kinds of lectures, to play like an online Pictionary game together. So it's these really small initiatives that are really helping to still have young people connect with each other that are very feasible online, I would think. Yeah, and that can really be encouraged from the institute itself.
Thank you, Paul. I think just to follow on from that, I think, so obviously talking about young people generally, Alex, if I may, thinking more about same sort of question really, but young professionals, how, if social distancing was to be a continued thing for years to come, how do we ensure that young professionals start in new work or involved in new work and in jobs, and particularly maybe in the healthcare sector, keep their support networks? How have you been doing that? Have you found a way, or how do you think we could do it going forward?
Yeah, I think it's such an important aspect to address actually of all of this, because of the support that we get from those networks. In terms of kind of looking at the future with it, I think it's going to be very tricky. I think we have to acknowledge that it's going to be a real challenge, but we're going to have to just move things more online, actually. And that's very difficult. It's very difficult for students of healthcare jobs, actually, because so much of it is practical skills that you're learning. So it's a real challenge to give people those skills. But I think, yeah, it's just chipping away, basically, at it.
Fair enough. Thank you very much, Alex. I think I mean, if I can I know I'm the moderator, but I know that at the start of lockdown, everyone went Zoom, Teams, full blast, plugging in brilliant. I can now have 4 social dates in the evening, all in one evening, and see all my friends. And it became very tiring very quickly. So I do think there is an element and a space for people to be more creative with how they meet in, and realize that actually short meetings are okay. A quick 20-minute hello can do it with a friend. Because I know when you're in these boxes trying to all chat at the same time, after about 45 minutes, there's 10 of us and we don't know what else to say to each other because we want to talk to the individuals. Okay, well, that's the end of the panel discussion for now. We did have more questions, but unfortunately we don't have any more time for this. So I'd like to say a huge thank you to Emmy, Paul, Alex, and Sarah. The question is, what can we do in our fields to ensure young people, young adults, professionals are supported and mentally prepared for the new normal? Welcome back, everyone. I was privileged to be part of an actual group then and had some very interesting discussions about what could be done. And whose responsibility is it? So I hope everyone found that useful. And so in order to reflect on that, we're not necessarily going to ask you all to share. But I guess it's a case of you reflecting on these ideas going forward. If I don't know, and I guess maybe you know more than me, there's the Bella platform that you're all already on, where you can see who you've spoken to and find their email addresses and things before the end of this day today. So that brings us to a close for today on the session, Working and Living in a New Normality, a spotlight on young professionals' mental health during COVID-19. I'd like to give a huge thank you to all of our panel members. I know Sarah had to leave, but a huge thank you to Alex, Emmy, and Paul. And I guess, I don't know about everyone else, but I know some things that have been discussed across the board here today are about what are the outcomes of this sort of session. What are we going to be doing to go forward? And Sarah mentioned something in one of her answers earlier about it's not just it's not one person's responsibility. It is something that we need to come together and do together. My memories from Gastein, I got so many contacts. It really painted the picture of the importance of working together, from practitioner to patient to public health, and communication and the importance that takes. It takes a holistic approach, especially as we try to think of new ideas going forward. And that we can all make change. We do all have the possibility to make change, and that mental health is everyone's responsibility. With that being said, I would just like to, I'm going to give them a second to think, to give all the panel members a short minute sign off of their final thoughts, which I did warn them about at the start. So I'm going to ask Alex if you could just share a final thought for the day, please. And then I'm going to
I think that was less than a minute. No, but what would I say? Okay, 1 minute. We are in an acute on chronic public health crisis. There is no health without mental health. And we unfortunately didn't touch upon the big elephant in the room here, which is it's the stigma that still surrounds mental health. So I think we need to attack it from all angles. And it was a really inspiring session today. So thank you.
Thank you very much, Alex. Emmy, any final thoughts?
No, I guess.
What are you going to do? What are you going to do? Take away from today's session? What have you learned?
I would say, yeah, I was very inspired, like to see like other people's like perspective and how like different, of course, like the situation looks for everyone and how the challenges might be different for everyone. So I guess like it really helped me to realize that like how on different levels, like it's all connected, but the different issues we face right now may be different.
Brilliant. Thank you very much, Emmy. And lastly, Paul, final thoughts. What are your takeaways from today's discussions?
I think my main takeaway would be that it's quite noticeable that there are quite a few things that have become harder for young professionals and young people during COVID, and that it is important to support them in many ways to find new ways of dealing with those things that have become harder and to provide them with structure to being able to undertake the things that they need to do in their life. And at the same time, also acknowledge that there are some things, that is something that we didn't touch on about today, that have actually become better during COVID. For example, people discovering new hobbies, something that I think was mentioned, or people feeling less social responsibilities, less pressure to, less FOMO, for example, fear of missing out. And these are things that going forward, I think would also be interesting to see. Why are these in our normal structures of life, and why are these not important anymore during COVID? And what can we also learn from our experiences during COVID?
Brilliant. Thank you very much, Paul. Well, from myself and the rest of the team, I'd just like to thank everyone for coming today. And taking part in this session and giving your views and insights during the breakout. Unfortunately, if we had another half an hour, we could go through and hear all the fantastic things that hopefully people have discussed. But please do share on the usual platforms, Twitter and Instagram. I know Gastein and young Gasteiners have tags that you can do. And a bit of a plug about Euro Youth Mental Health, World Mental Health Youth Day next Friday. You can find out more about that on our website. Yes, and so have a lovely day. Enjoy dancing with the elephants later on as you finish the event. And it's been fantastic being part of this. Thank you from myself to the Gastein team for all your hard work. Hashtag YFG 2020 and hashtag EHFG 2020. Yeah, stay healthy, everyone, mentally as well.